Should we start the class now, or should we wait for your friends? How are you feeling? Are you enthusiastic in joining the MBBS course, or?
Yes, ma'am.
Are you sure?
Yes, ma'am, 100%.
100%. Who is the one who answered that?
Himanshi.
Okay. So you are 100% sure. All of you are at home, right? No one is in the hostel, right? Himanshi, you are from which place?
Ma'am, I'm from Delhi.
Can you show your face? Okay. So you haven't got COVID yet, right? Or
No,
have you
ma'am.
been infected? No.
No,
Okay. Congratulations, all of you, for getting through the NEET exam and getting placed in the in ZMC. So today our topic will be on the process of learning in medicine. So what do you know anything about medicine learning? Anyone knows anything? Come on, just feel free. I'm not going to beat you up. Just answer whatever I ask you. Okay.
Ma'am, during NEET preparation, I realized that if I don't complete the work of day in that day only, it will be a very really big problem because of the backlog. So the most important thing is consistency and doing the day assigned to us in that day only.
Yeah. So as Himanshi said, like you'll be having assignment on and off, and teachers will be teaching, so they'll come in and out. So you might get confused later on if you piled up whatever had been said or taught in the class. So if you keep on piling up, at the end you'll get confused. And medicine is such that, you know, the branches are so vast that you can't just muck up in one night. It's not like biology, zoology, or chemistry or physics. Those are very small topics. It's just, what to say, it's a very small introduction, actually. So when you have the classes, when you start having classes from anatomy, physiology, biochemistry, community medicine, then you'll realize that, you know, the medicine subject as such, it's very vast. So you have to be, so what is your main aim after joining this medicine? Main aim in joining this MBBS course? Someone can answer? Maria, can you tell me? Maria Gangte, can you tell me what is your main aim? To be a good doctor, right? Am I right? You want to be a good doctor?
Yes, ma'am.
Okay, so you want to be a good clinician. You want to wear a stethoscope and see the patient, diagnose the patient correctly, and treat the patients, right? So you want to be a good clinician. But apart from that, before being a clinician, what all should you do? Anyone can tell me?
We have to become
can tell me?
competent.
Pardon?
We have to become competent.
Yeah, competent. So competent to be a clinician, right? So in order to be a competent clinician, what all should you do? You have to, what? You have to finish all the competencies which are required as an MBBS students, right? You have learned about competencies. Am I right? Yes or no?
Yes,
anything
ma'am.
about competency? Someone can tell about competency? Rosang Liana, can you tell me? Can you tell me what do you mean by
from 2022 there will be like next exam?
Yeah. So
My competency means that the ability to apply the things we learn during the
Yes.
course of MBBS or MBBS. Yes, being able to apply the things we learn in the field
so you
and
have
in
to,
patients.
so they'll be teaching you in every, like, anatomy, physiology, biochemistry, and community medicine. Those are the 4 subjects which you'll be learning in the first year. But they'll have you'll have this early clinical exposure. That means when you have an anatomy class, or a topic on, for example, on abdomen. So on liver or liver functions in the case of biochemistry and physiology. So you'll be taken to the medicine class and you'll have an exposure to how the child, how the patient is presenting. Okay, like liver failure, how the child, how the patient is presenting, how the male alcoholic liver failure, how does it present clinically. So you'll have a good exposure in the first year itself. So are you enthusiastic about it? So I'll just share you a few screens which I have prepared. Could you see?
Yes, ma'am.
Yes, ma'am.
We'll be going through the learning process. As you have said, you have, yeah. So the role of our Indian medical graduate is, after graduating, everyone will expect you to be a good clinician, right? And you have to be a good leader also. In order to lead, you have to know something, right? So during the MBBS course, we'll keep on teaching you every year, different phases, different faculties will keep on teaching you the subjects. Then in order to be a good leader, you have to be very competent with what all you have learned so far. But while after finishing MBBS, it doesn't mean that you stop learning, but you have to be a, what? You have to be a lifelong learner, right? So for me also, like as a faculty, I keep on reading. I have to keep on reading journals, the latest publications, the latest treatment, right? So it doesn't mean like, you know, you just sit back and relax that you finish your MBBS course. It's just the beginning, okay? It's like MBBS is the basic and you have to build it yourself. So clinician is what? What do we mean by clinician? A clinician is a physician or qualified person who is involved in the treatment and observation of the living patient. So some of you might branch out into anesthesiologist, maybe pediatrician or cardiologist, surgeon, like that, right? Medicine, internal medicine. So you'll have different specialties. Okay, so depending on that, like depending on your interest, you'll branch out again. But as an MBBS student, as an Indian medical graduate, everyone will expect you to be a good clinician. Okay, so those are the basic things which you have, which you'll be learning. Then, as I've said, and the role of an IMG, that is, role of Indian medical graduate is to be a clinician, then a leader. A leader is a person who leads or commands a group. So you might be posted in a peripheral, in a PHC, okay, PHC or CHC, community health center, or somewhere in the peripheries. So under you, there will be staff nurses, so many the nursing superintendent will be there, the nurses will be there, then the 4 grades will be there, then those compounders distributing those medicines will be there, the storekeeper will be there. So you'll be the leader in that, in the peripheral center or community health center or wherever. Suppose if you are if you are specialized in internal medicine, so a group of doctors under you will be there, the postgraduates will be there, the interns will be there, okay, the JRs, the junior residents will be there, the senior residents will be there. So you have to learn to be a good leader. In order to be a good leader, you have to know your basics, okay, the MBBS course, the competencies very well. So as I've said, this medical course is an ongoing, voluntary and self-motivated. We should be a lifelong learner. It's not just like, you know, it's just the beginning. You keep on learning till the end. You keep on reading. Okay, you have to read the journals later on when you pass out your MBBS, your postgraduates, you have to read the journals, read the latest medications, read the latest treatment. Okay, now we are having pandemic of COVID. So new medicines, new medications had come up, and people are doing research on what will be the best medications for the for treating COVID, right? and for what will be the what will be the vaccines, the best vaccines for it. So there are those people who are working and research, doing research, and you'll also be doing research, seeing the whether the patient is improving with the medications you're giving or not, and all the clinical signs and symptoms. So you'll be a lifelong learner. So you have to gear up yourself. You can't be just sit back and relax. Okay, you have to gear up yourself. And what are the good practices which you will be which you need to have as a medical student? First is what? Anyone can tell me?
Interaction with teachers.
Yes, we have to have a good interaction with the teachers. If you keep on keeping quiet and just stay in a corner, no one will understand what you have, the problems you're having. So you have to open out. No one is perfect. You have to open out to the teachers. You ask your problems, solve your problems. So you can do it in the class itself. Teacher will ask you, do you understand the topic? Then you have to raise your hands. Don't feel scared. No one will laugh at you, okay? Because they are in the same boat, okay? No one is perfect. So you can ask those questions which you have in your mind, okay? Maybe you don't have time in the class to ask, but you can ask them in the outside the classes also. Nowadays, we have all mobile phones. You can ask through WhatsApp, okay? Then you have to get help from the teacher. Suppose if you have a very tough topic, you have to get help from the teacher, asking them to explain it again, okay, so that you'll be able to understand. It's a very tough thing, okay? So after having learning the competencies or whatever have been taught in the class, you have to have good interaction with your peers, with your friends, with your batchmates. You can form a group also, study group, so that you'll learn better. Though there are things which you can learn alone, there are things which you have to learn in a group. So you will have small groups, subgroups again, small group teaching will be there, small group learning will be there. So small group lectures will be there also. So you'll have so many group activities. Apart from that, you can have your study group with your friends. You can go to the library, consult the textbooks, or you if the internet is very good, you can do it with your laptop, with your mobiles, okay? Then you have to have a active learning, right? Then you have to, as Himanshi said, you have to be time on the task. You have to set the target. Whatever competencies had been set in the class or had been taught in the class, you have to finish it off there and then. Don't pile up at the end, because you'll have internal assessment, you will have summative assessment and formative assessment. We teachers will be looking on you, like whether you are really doing well or not. Or suppose if you fumble so much in the final exam, but in the formative exams, if you have done well, very, very well, teacher will understand that you have a little bit nervous or something like that. Like maybe you won't know. We all don't know what will happen next. Maybe in the final exam, you might fall sick also. So formative assessment is very important. Internal assessment is very important. You have to do all those assessment very well. Okay, complete your competencies in time. Okay. Then, as I've said, you have to time yourself. You can make a checklist also. Okay, concentrate on what is important first. Okay, so the teachers will give you assignments. Then you'll know which one to complete first and which you can keep next. Okay, then you have, as I've said, you have to form a group with your batchmates and share ideas and discuss. And all of you will be having your mentors. Okay, so if you have any problem, suppose apart from studies, if you have any problem, you can contact your mentors. Suppose if you have some nervous breakdown or anxiety or depression or something like that, or anything psychological problem or any medical problem, you can contact your mentors. Okay, So as I've said, if there's no clarity in the task which had been taught in the class, you have to approach the teacher and the faculty concerned. And teacher will really know that you are interested. Okay. Otherwise, if you just keep quiet and just pile up your doubts, then you'll have problems at the end of the first at the end of the term or at the end of the phase exam. So in medical school, we have two types like knowledge. One is factual knowledge and the procedural knowledge. Okay, factual knowledge is a theoretical background. Okay, what all, like for example, in anatomy, you'll be having class on cubital fossa. The muscles which are there in the cubital fossa, the nerves, the veins, and the arteries which are present in that structure. So those are the facts. You have to learn it by heart. If you don't know it by heart, then you won't be able to reproduce it in your exam. And after knowing the facts, you'll be able to apply in your in the procedural knowledge. Okay, so in the practical part, when you have the, for example, surface marking, if you don't know the facts, you won't be able to do any surface marking. Okay, so those what all knowledge you have, the factual knowledge, you'll be applying. That's the main two forms, factual and the procedural knowledge in the of learning in medical school. Okay, so you have to learn the facts properly, very thorough with it. How to learn, we'll go through it again. So what will be the best way? You have to practice. Okay, without practice, it's very difficult to memorize or to remember. Okay, it's like, when for some of you, you might be going to gym, right? Anyone had gone to the gym so far during this break, or have been doing exercises at home? Anyone?
I
Guys?
have done some exercises, but
Very
I've
good.
not been to gym.
So we are exercising to what? To make ourselves fit, right? So that we can be strong or build a muscle, right? So that you can run, so that your body will be fit. Am I right? Just like that, you have to keep into practice whatever you have learned. Okay. How you can go about, we'll be going through it again in the next few topics. Okay, there are the three topics of effective learning. One is the test effect. Okay, one is test effect, active recall, then spaced repetition. What do we mean by testing effect? Anyone can tell me? Can you tell me what do we mean by test effect? Anything which comes to your mind, you can just share.
We need to face the exams.
Okay, but before facing the exams, you have to know the facts, right? I told you that the factual knowledge is there. You have to know the facts. For example, as I've said earlier, in anatomy and the cubital fossa, you have to read the facts first. What are the muscles involved? The veins which passes through it, and what are the nerves, and what are the arteries. Okay, you have to know the facts. You summarize them. You keep on studying again and again. Okay, if you just read once, you won't be able to remember because it's very complicated. What are the muscles involved? What are the veins passing through it? Okay, then you memorize them again and again. You have to give a written or oral. You can write it down on a piece of paper, and you can discuss with your friends. You can tell me. You can tell your friends, these are the muscles which are in which are seen in the cubital fossa. The arteries these arteries are passing through it. The veins, nerves, like that. The femoral triangle. All those, you have to draw a diagram. These are the examples. Okay, these are the examples. There are lots. Like, it's just the beginning. So you draw a diagram of the whatever you have learned in anatomy, especially in anatomy, you have to keep on drawing the diagrams, whatever diagrams, maybe the liver also. So you have to know how many compartments are there in the liver. You have to memorize first, then draw it down and narrate it out to your friends also. Okay. So so testing is an effective element. So teacher will keep on giving you tests, but in meantime you have to test yourself. So recall is the most important thing. Okay, if you keep on recollecting whatever you have learned, for example, today you learned something, the next morning maybe you take around 5-10 minutes just to recollect whatever you have learned. Okay, so at the end of the in the weekend you can recollect whatever you have studied the whole week. Why I'm telling you all this is because at the end of this MBBS, the final MBBS, you'll be having the exam called next, that is a national exit test. So if you pile up everything for the last moment, you won't be able to remember everything. So from now onwards, from the day one of the class, you have to start studying seriously. Okay, you have to really start studying seriously. We won't be able to help you because it will be a national level test. If you don't clear the national exit test, then you won't be fit to do your internship or to have a MBBS degree. So as I've told you, you have to have an active recollect whatever you have studied. Okay, then suppose if you can't remember anything properly, you can keep on writing, and you make a strategy how you can study very well. For me, like while doing my MBBS, I write down whatever I have studied. Like for example, for anatomy also, whatever topics, if I study the liver, I write down, make down a small notes which I can I'll be able to revise at the end or like during my exam time, because during exam time you won't be able to go through the whole textbook. Remember, keep it in points so that you can remember at the last moment. Okay, last revision, that is for the final exams of the first year, for example. Okay, then draw the diagrams again and again so that you'll be able to memorize it in your and have a photo memory in your brain, so that you'll be able to reproduce it very well in the exam. Okay, then as I've told you, like you have to keep on practicing and recollect it maybe after 1 week, after 2 weeks, because at the end in the term exam it might be too much for you to recollect the whole thing. So you have to keep on recollecting, maybe weekly, or as I had said, whatever you studied today, you recollect early morning, the next morning, and memorize it in your brain. Okay, then whenever you learn factual knowledge, whatever is in the textbook, you test yourself. As I've said, test yourself while learning, not just memorizing, you just test yourself also. Then active recalling, then you have to do your the retest again and again. Then if you have any problem regarding the learning or understanding the whatever the knowledge, the competencies which had been covered in the class, you can ask your teachers. Okay, in first year MBBS, you'll be having anatomy, physiology, biochemistry, and the community medicine. So you have 4 subjects in the beginning, but you'll be having exam for the 3 subjects first. Okay, first year MBBS, 3 subjects. It doesn't mean that you shouldn't pay attention to the community medicine. Okay, you have to start learning the community medicine. Then from the second year onwards, you'll be having 18 subjects. 18 subjects. The main subjects will be the pathology, microbiology, pharmacology, and you'll be having all the other subjects like forensic medicine, community medicine, the internal medicine, anesthesiology class, then pediatrics class, obs gynae. So all the 18 subjects will come into play in the second year. So you might get confused. You might leave it for the last moment to study. But you, as I've told you, you make a note and make a notebook for every subject. Your notebook for the class and the notebook for studying in the in your hostel. Okay. Otherwise, it will pile up and you'll get totally confused. And at the final exam or national exit test, we won't be able to help you out. Okay. So any doubts anyone can ask me? Someone can ask, anyone can ask me? Any problem? You want to understand, having problems with understanding?
Ma'am,
No, ma'am.
Yes? Tell. Just open up.
Can
Yes?
we
Tell.
make the short notes? Can we make the short notes of
Yes, obviously. You have to make a,
whatever we studied?
yeah, that's very good. That's a very good point. Whatever you have studied, for example, I have said like in anatomy, you'll be having the liver, for example, the surface marking of the liver will be there, the factual knowledge, what are the what are the veins which passes through, are the anatomical structures, the features. And then you'll have the biochemical part, that is the liver function. So you can coordinate also. And you know, for learning, like for example, if you learn, as I've said, for learning an organ, you can correlate with the other subjects like biochemistry, the physiology, for lungs, also for the respiratory system. When you have anatomy class in for lungs, and then surface marking of lungs, then the you'll be having the pulmonary function test and all those in the physiology. Then again in biochemistry also you'll be having some tests for the for the lungs. Okay, so you can correlate that, and we'll be having this horizontal integration, like when you study the particular organ in anatomy, physiology people will be taking the similar classes aligning with the topic. So you can have a note of it. Then at the end, like you're really able to compile. When you come to the second year, you'll be able to correlate with the findings. Seeing the alcoholic liver failure, or some respiratory problems, okay, or tuberculosis. So you'll be able to have a clear concept of whatever you have been said earlier. So start making notes from day one itself. Don't pile up anything for the last moment. Okay, you might feel very lost, but you just keep on having notes. Notes are very important. Whenever teacher take classes, you at the end, if you can't take notes during the class, you just try to collect just after the class, or maybe during the class the important points. Okay, so everything is here in your textbook, but teachers will be stressing on the important topics. Those important topics you keep on noting down, because those there are competencies which you have to really know thoroughly in order to pass, or in order to get promoted to the next the second year. Okay, so those are the core competencies. Core competencies are those which you have to really know it, otherwise you won't be able to be promoted. Okay, any other doubts? You can just open up, share. The message which I wanted to convey to you, all of you, is you have to really concentrate on your studies. And another thing is you shouldn't pile up whatever had been taught, and you have to take this curriculum very seriously. Okay, meantime you have your friends, you can chat, and you have your time for recreation, going to the gym, or going or playing a basketball or something. But major thing is you have to really concentrate and read thoroughly. Okay. And you have to really take care of your health also. If you have any problem, you can consult the faculties and tell them, your mentor, asking them which consultant should you to which you would go to for the illnesses. Okay, we never know, someone might be having some problems, medical problems. So just open up, don't be quiet, you have to open up. Okay. And whenever teachers ask you questions, don't keep quiet, you have to open up yourself and ask the questions, the doubts, whatever you have in your mind. Anyone wants to ask anything? Come on.
Miss,
Yes.
according to your experience, how tough is MBBS?
Yeah, it's quite tough, but first year for me, like I joined very late. That is I joined, they started the class in the month of June or July, but I joined in the end of August. So end of August, early part of September. So I have to really catch up whatever they have studied. Within 1 month itself, you have covered so much. They have covered so much. So I have to really, first year was very tough for me. But in second year onwards, it was really great because I've how I studied was, as I've said, I recollect those factual knowledge, make down the notes for the final recollections. Then I keep on testing again and again. And, as I've said, like you can form a group also, a group of 2 or 3, so that whatever you studied, you can just share with your friends, and we used to discuss over the table also during the dinner time, discuss, suppose if I find something hard and I won't feel like going to the faculty asking my problems, I ask my friends who are like, who had understood the topic very well, or they'll ask me the topics which I've understood very well. So it's like that, we keep on sharing. It's like, active learning. You keep on sharing with your friends. And suppose if you find something like easy method which you can study, like as you study, you'll find out which method will be best for you. But what I suggest is you make down good notes. Good notes are very important, and recollecting, of course, and drawing the diagrams for anatomy, for physiology and biochemistry also. You'll be having those flow diagrams, flow charts and all, and you have to, those cycles, Krebs cycles, so many cycles will be there. So you have to know it thoroughly, and you can make use of the walls of your room and make down, jot down those points which you have to memorize it very well. Those maybe the cycles, maybe the diagrams also. So my wall used to be full of diagrams and so many important points, So it's like that, and you'll enjoy it at the same time also because it's a new thing. And if you are very good in your basics, I was quite good in my anatomy, so like it was very helpful during the surgery time. And until now, it's very helpful to me because, for example, as a medical student, we might not be very fluent with putting an IV line, but if you know the course of the veins, it's very easy. That's it helps me a lot as a pediatrician because pediatrics veins are very small. So like I could do very well with the venous, putting cannula also. So those basic things, if you learn very well during your first year, it will be quite easy at the end. Like for a surgery, for anything for that matter, it's those basics. If your foundation is very good, then you'll enjoy all along the course. Any other things you want to ask? Just keep on opening up. More Sailavi, why don't you show your face? Are you sick? Emily?
Ma'am, I want
Yeah?
to ask. Will be there a teaching on how to place our answer papers, or we will learn with time?
Yeah, those answer papers, yeah, you'll be learning with times. Main thing is what I suggest for you while writing the answers, you have to be to the point. Okay, we want points, so there are important points. So like there as you go through your textbook, you'll have those highlighted ones, and you'll have those subtopics also. So you 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 needn't by heart the whole thing. Those important points you have to really stress, you know, and you have to answer to the point as possible. And while giving exam, don't leave any questions unanswered. Okay, you have to answer everything, whatever you know, you have to answer. And those maybe for example, you have 5 questions, and apart from that, you know only 3 thoroughly. Those three questions, you answer it in a very well presented manner. Whatever you have learned, reproduce it very well. Those, the last 2, which you don't know thoroughly, maybe the question number 1, you don't know it very well. So you go to the question number 2. Don't try to answer the one which you don't know very well in the beginning. Keep it for the last, so that whatever, when you have time, you will be able to recollect. Whatever you know properly, answer it in the beginning, and later on, whatever like you feel a little bit confused or some ideas you have, you can answer it at the end of the, I mean, after finishing whatever you have known very well. Okay, so don't waste so much time in drawing lines and all. Okay, space your answers very well, write it neatly, clearly, to the point. And whatever points you want to highlight, you stress it with maybe colorful pens, like green colored or yellow colored. Don't use red, because teachers will be using red. And if you mark with red, teacher might think that, like, you know, you have done it wrong. Okay, so use other colors apart from red. Then and present it neatly as much as possible. As time goes, you'll be able to learn, and you'll be having lots of tests in between also, the internal assessment and the vivas also. When you come to the second year, you'll have those clinical exposure, more clinical postings, and that time you'll be having those clinical posting exams and the internal assessment. Okay, so any other doubts, you keep on asking.
Ma'am?
Emily, why you're not showing your face? Emily Zorempu, you have joined in 2 places.
Yes, ma'am. I'm joining in my phone and in my laptop.
Okay, fine. Then, okay, you wanted to say something.
Yes, ma'am. Ma'am, can you talk about when you were in med school, can you talk about your time management? Because with anatomy being a very large subject, and there's also physiology and biochemistry. So can you tell us how you managed your time studying those 3 subjects and how many hours you took for each subject?
First year, I spent most of the time in studying because I go, like, since I'm a Christian, I go to the church on Sunday, Sunday morning and afternoon. So I keep time, at least I go to the church at 7 o'clock in the morning. There we have the morning service and evening fellowship. So I attend those 2. But in meantime, that is from 9 o'clock till 12 o'clock, I study again. That is on Sundays. Sundays also I study very, very hard. I go to the library. In those days, like, libraries were open 24 hours in our days. But now you have your internets, and library is also open, I guess, on Saturdays. Sundays, I'm not sure. In ZMC, Saturdays it's open, I think, at least half day. So whatever, as I said, like, whatever we study, for example, head and neck, or some the brain, for example, neuroanat, I draw the diagrams again and again when I come back to the class. When I come back from the class, I draw the diagrams, study with, because anatomy you have to really know with the diagrams. You know, if you know the diagrams very well, you can reproduce it very well. That's what I've learned. Like, and for biochemistry also, you have to know the cycles very well and keep on drawing again and again so that you can memorize it. And if you know the cycles, you can reproduce it in the, as you write the short notes also. Okay. So recollection is very important. Most of the time, I could say that I spend my time in studying, and my free time, I go to the church and as a fellowship. And first year was very tough. I hardly spend time recreating. Okay, I go to the in weekend. I spend around maybe 3 hours to the beach. Ours was, I was fortunate. I was in the Pondicherry where the beach is there. I can relax for some time. That I go once in a month like that and relax and take a fresh air. And it doesn't mean that you should be cooped up in your room the whole time, but you should relax, and relax in the sense you should come out of your room. And but during this COVID time, it might be difficult to have a group discussion or share with your friends. So like as I've said, one thing constant, I recollect whatever I've studied in the class, then I mean the same day itself. Then weekend, if possible, I try to recollect whatever I've studied, and those points which I couldn't understand properly, I go to the library and see whether I have my doubts had been cleared or not. Then I test myself again and again, testing and draw the diagrams again and again. That's tips which I could give you. And I asked my friends also, like as I've said, like we used to discuss over the dinner table those important points and those subjects, those topics which might really come for the exams, Any other? I hope I answer your question. Is it okay?
Yes,
Are you
ma'am. Thank you, ma'am.
satisfied?
Yes, ma'am.
Then one thing for me, like during my MBBS days, like the only, like you might feel anxious and you might have some anxiety or some, maybe since the topic is, for me, first year, it was, since I joined very late, it was very tough. And in the beginning, I wanted to quit, actually, not quit, actually, like I wanted to change my my medical college to the to the place near to my hometown. But finally, like I realized that I didn't regret, because I continued with the same medical college. First year it's very tough. You'll have lots of work, and it's totally different from those biology and those what is it, chemistry, and the others, zoology or whatever we have studied in 11th and 12th. So it's, it's, the topic is too vast and you won't be able to memorize the whole thing in one go. So you have those important points you have to note down again and again. Teachers will be stressing on those important competencies. So you have to note down, okay? The textbooks are very vast. You can't by heart the whole thing. So you have to keep in mind those important ones. And teachers will keep on telling you, this is a core competency, this is the important ones, you have to know it for the exam. Then you have to really keep in your mind that you have to memorize it very well. Okay. Then for my, like whenever I feel anxious or anything, like for me as a Christian, I pray a lot and I have my quiet time, and like meditation is also very good. I keep time for my prayers and Bible reading. So that helps me a lot all throughout my journey in MBBS and my postgraduate. And like with God's grace, like if I'm not mistaken, during my final exam also, I didn't miss my church service at all, in both in postgraduates and in my MBBS exam, final MBBS. So like I don't compromise on that part as a like for my religion and for my belief. And whenever I have some kind of anxiety or depression, a little bit depression, I have my mentor, my senior mentor. She is very good now. She is well settled in Malaysia. So like we come and pray and we sort out those important those points, which hard points, tough areas which I have wanted to overcome. So it's like that. You'll be having your senior mentees, I think, mentors. So apart from the faculty mentors, you'll be having senior mentors, I think, hopefully. You'll be assigned, so you can ask, and your teachers, your faculty mentors, you should be close to them, because they are the one who had gone through all this, and they'll be able to help you sail through. And any other thing you wanted to ask?
Ma'am, one question.
Yes.
Studying in ZMC, do you think we will have time to exercise our body?
There is there is a proposal coming up for the gym, but exercising, like as I've told you, during my MBBS, like I do evening walk. Means just after dinner, I go out for a stroll for some time, not very long stroll. Then I feel that was quite enough. And taking hard exercises, you might not have that much time. So you can do it in your room, or like, you can time yourself maybe 15 minutes, like that 15 minutes. See, as you study, you feel stressed out. During that time, like you can use 15 minutes break or 30 minutes break. During that time, you can have a short walk, or, the exercises you have. So you can make use of the time. And as I've said, you have to time yourself very well. Any other doubts? I hope I'm clear. I hope I clear your doubts, Zamliani.
Yes, miss. Thank you, ma'am.
Yes. Then, anyone?
Ma'am, I
wants
have
to
a
ask?
question.
Yes.
Ma'am, the previous day, Sir Manoj was telling us that we must, it would be good if we read international authors' books. As we know, there are many authors for a single subject. How do we know which author will suit us, or do we have to figure it out by ourselves, or are the professors going to tell us?
Yeah, you can ask the professors which books you should consult. There are basic subject textbooks, which you have to really know it thoroughly. International authors are also very good, but Indian authors also, like for pediatrics, for example, we have OP Guide textbook. So Meherban Singh, they have written very well. They are like international presenters. So they have presented their papers in the international level. So like, it doesn't mean that if they are Indian authors also, like they are like foreign authors, they have been presenting their papers in the international level. Okay. So it's like, like for us also as a faculty, like we write the journal, write our research paper, and and it's been published in the international level also. So it doesn't mean that like those Indian authors are not international level. So you can consult your teachers regarding which book to read, and which is the best for you. Okay. Any other doubts? I hope I clear your doubts to Sita.
Yes,
You are
ma'am.
from which place?
I'm from Assam, but
Okay.
since childhood I've been staying in Mizoram.
Okay, fine. You know Mizo?
Yes, ma'am.
Okay. Who is Lal Nundlimi? Where is Lal Nundlimi? Why are you not showing your face? Okay, fine. Any other doubts? I
Ma'am,
have 10 minutes more.
ma'am,
Yes.
do we need to wake up early in the morning?
Depends on like like as an MBBS student, it's very difficult because for me, like in the later part, I stayed up late at night. So I read till around 12 o'clock, maybe 1 o'clock sometimes if I'm really engrossed. But you have to attend the class, I think, at around 8 o'clock from when you are in offline. Am I right? 8 o'clock or 9 o'clock, minimum 8 or 9 o'clock. So you have to wake up to attend the class. So get up at least by 7:30 so that everything you'll be able to finish. Okay, brushing your teeth or having a short breakfast or something like that, because with empty stomach it's very difficult to listen to whatever your teacher will be putting into your brain. Eat properly, sleep properly, don't waste time, don't use unnecessary medications, okay, for sleeping or don't get involved with alcohol or drugs. Or if you have any problem regarding that, you have to consult your teachers, okay? If you have depression, don't take any medications by yourself and without consulting your teachers. You might have, because it's MBBS, as I've told you, it's not a easy course, okay? It's not an easy course. You'll be having, as I've told you, in the second year, you'll be having 18 subjects. So it's not an easy course. So don't get into depression and don't land up abusing any medicines or anything or any substances, okay? And if you think you are prone to it, you consult your mentors and consult your faculties. Faculties are very nice, okay? And hope I answered your question. Is it okay? So you have to be well in time for the class. Don't bunk your classes, because of your seniors, especially the 2018 batch, they've started not attending the classes during because of the Wi-Fi problem and the internet problems. They couldn't attend properly. But as much as possible, you try to attend. Go to your friend's room, where if it is online, go to the place where you can get the connectivity well. Okay, hopefully we'll be able to have the offline class very soon, and there and then clear your doubts and sleep properly. Better to sleep early so that you can get up early and refresh your brain. If you sleep up late, your head will be heavy. Okay, I don't suggest you to stay up late, but some people are there, we are different. Some people stay up late at night and study well, concentrating well. And that depends on a person to person, but don't stay up too late, because you need energy also. And while studying, you drink lots of water, minimum 2 liters per day, okay? That's good. At least it will wash out all the toxins and whatever the radicals, the bad radicals will be washed out. Then you'll feel fresh while studying.
Ma'am, on average,
Yes.
how many hours did you sleep during your MBBS?
You know, teachers said we have to sleep during our days. We have to sleep minimum 5 hours. So minimum 5 hours you have to sleep, 5 to 6 hours. If you sleep too less, your head will be heavy. You'll feel dizziness. You'll have dizziness. For me, I sleep quite a lot. I like sleeping, but I can't suggest you to sleep like me. Whenever I have time for sleeping, I sleep. Till now, it's like that. Like when I have time, I sleep, and because it refreshes my brain. I feel refreshed when I sleep a lot. So some people are like that. When they sleep, their mind gets refreshed. Some people feel like when they exercise, their minds are refreshed. Don't over exercise, don't oversleep. Okay, and those two important things are there. You have to keep in your mind. Any other doubts? Any other? I hope I clear your questions. Any other?
Ma'am, I have one question.
Yes.
When is the right time to prepare for our NEET PG? Should we start from during our MBBS days or
Yes.
right after?
See, for you all, as I've said, you'll have your national exit test. During that national exit test, it will be like MCQs. So like some questions from the anatomy will come, some questions from the physiology will come, some questions from the biochemistry part, and maximum from internal medicines and medicine and allied. So that will be, I hope, we'll be telling you again how to study and how to go about. But from now on, it's better to have a good concept. That's why I keep on telling you, make a good note so that you can make use of it in the final national exit test. Okay. So now itself, it's very important. Whatever you study now, you can recollect it very well. Your brains are fresh and you are very young. Most of you are 18 years old, right? 18 or 17. How many of you are in 18? Can you raise your hands? How many of you are 18 years old? How many of you 17 years old? 16 years old? No one. 18, 19? No one is 19. Anyone is 19? Very good. 20? So it's the prime time,
20.
you know, till what from my experience, like I feel like we can study very well before before 30, before reaching 30. So whatever you want to, whatever aim you have, for example, you might be your aim might be a neurosurgeon, a cardiologist, or something like that, and you should start, you know, timing yourself. As soon as you finish your internship, you can go straight away for your, suppose if you do your national exit test very well, you'll have a good placement and you'll have your postgraduates of the subject of your choice. For in aims, like during our days, those people who score very well for surgery in the postgraduates, and if they opt for surgery, they go straight away for the neurosurgeon. That is a 5 years course instead of the 6 years. You know, 3 years is a PG course and another 2 years for the super specialty. But suppose if you finish your exam, the postgraduate exam after 3 years, and if you have to write your DM or MCH, your super specialty, you have to do another 3 years. So in one shot, instead of finishing within 5 years, you have to finish it off within 6 years. So you'll be wasting time. So whatever the, you know, you are very productive before 30 years. So you will learn maximum, do your maximum, don't keep anything priority apart from your studies, you know, apart from your studies. Okay, your parents might bring you up, you might be having some relation. Don't you tell your parents to pray for you so that you can study very well. Don't disturb your minds. Okay, you have to really concentrate. What I want to stress is you have to really concentrate. Don't get your mind deviated with other things, otherwise you'll lose your time and you won't be able to finish your course in time with your friends. And it's like, you know, it's like once it's rolling, it will be, you know, people will roll on, your batchmates will roll on, and if you have problem in between and if you don't tackle it first, then you'll be lacking behind, just wasting time and money. Okay, all the best for your future, and I hope you enjoy the course. And if you have any problem, you can ask me, and you can ask the mentors, your mentors also. All of us are open. I think our mobile numbers will be given to all of you so that you can contact us if you have any problem. Okay, either family problem or something problem, or some internal problems which you don't want to share with your friends. So you can just contact the faculties. Okay, feel free. We are all there to help you all. We want you to shine out, and I want you all to clear your national exit test in one shot, not just lacking behind. Okay, if you don't clear in one shot, you have to give in the next year. It's like that, you know, you won't be able to have your degrees until you have your until you clear your national exit test. Okay, and any more doubts? I hope all the doubts have been answered. Am I right? All the best. Okay, then bye-bye.
Thank you, ma'am.
Thank you, ma'am.
Ma'am.
Thank you, ma'am.
Thank you,
ma'am.
Thank you, ma'am.
Bye.
Thank you, ma'am.
Thank you, ma'am.
Welcome.
students, please wait for around 10 minutes regarding the 12 to 1 session. The person in charge is, we're trying to contact the person who's in charge.
Good afternoon.
Good afternoon, ma'am.
Good afternoon.
Good afternoon, ma'am.
Can you please turn on your camera so that I can see all of you?
मैम आप दिख नहीं रहे, हम शेयरिंग जो शेयर करी थी।
So, first of all, a very warm welcome to Johor Medical College. And this is your foundation course. It will help you in how to cope up with medical educations, how to deal with stress and everything. And it's going to help you in your medical course. So first of all, I'm Dr. Pavitra. I'm from the Department of Forensic Medicine. And today we will be discussing about what is professionalism and what should be your attitude and some about the ethical behaviors which a doctor should have. Okay. So before I start the class or before I start this lecture on professionalism, what I would like to know from you is what is your point of view of what a professional means? Okay, so because can you please tell me what do you mean, what do you understand when we say professional?
The way to represent oneself or an individual or a part of or a section of society.
Okay, very good.
Ma'am,
So when, yes.
I think a professional is a person which has a whole knowledge, and he he is best from the other common man.
Yes.
He has the best knowledge.
Yes, someone who is doing the job in a better way than any other common man. Yes, that is good. But in otherwise, professional can be any person. For example, a professional can be a missionary, a stone carver. But if he's doing the job when he has to do it, then he become a professional. He can be a carpenter, a person who's building a table, but he's delivering his work on time. He's not giving any excuses. Okay, so a professional can be any person of any profession. He can be a lawyer, he can be a doctor, he can be an engineer, an architect, but they are doing their job regardless of their personal feelings, regardless of whether they are suffering from something or not. They have to deliver the job. That is what a professional does, right? A professional does not give any excuse. For example, take in our profession, being a doctor, you cannot say that today I'm feeling very lazy, I don't want to go to the work, right? So you have to do your duty. That is what a professional means, right? So, see, look at the picture. A person in coat, suit, tie, if he goes, suppose he is an architect, he is going to meet a client. If the client says something and he said, I don't care, boo, 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 then he's not being a professional, right? So, being a professional also has to do a lot with your attitude, not just your work, not just presenting your work. Okay. So the definition of professionalism: the conduct, aims, or qualities that characterize or mark a profession or a professional.
Ma'am, your slide is not moving.
My slide is not moving.
Yes, ma'am.
Yes, ma'am.
Can you see it now? Not yet.
No, ma'am.
Oh, get stuck again. Oh. Let me try again, okay? Or you can just listen. What's there? No need for the slides, okay? Just listen. This is not going to be in your exam or anything, so just listen and just get some ideas of what is a profession and what is a professional, and then what is ethics and what is attitude. All right, no need for the slides, because if I go out again, my internet is not good. That's why I took so long, because the internet connection is very slow today. I don't know why. Okay, so being professional is about having some kind of a strong skills, okay, and competence in that particular field. Like you have already said, right? You should have a skill and competence. The important thing is skill and competence. So professionalism is also about the qualities and behaviors that you exhibit and the manner in which you conduct yourself during your duty. If you are conducting in a very haphazard way, that is not also being a professional. So what are the characteristics a professional should possess? First of all, appearance. Appearance is very, very important, especially in this field, in the medical line. If you are very savvy, if you're not very neat and clean, the patient would not give the trust in you. So you must have already heard about dressing codes and all from your previous lecture, I believe. So
Yes, ma'am.
yes, dressing code is very, very important. So a professional should have a very neat appearance. And guys, you should not never wear a round collar t-shirts with an apron. It doesn't go well. At least wear, if you want to wear t-shirt also, at least you wear a polo t-shirt with a collar. Okay. And girls, you should be always neat and clean, with not long nails and nail polish and all those things. You can do it in your free time, but not during the college. And then demeanor. Your demeanor should reflect confidence. Okay, it should reflect confidence. And you should be very well polite and well spoken. And on the other hand, just because you're a warm and friendly person does not mean that your patient can call you sweetie or honey or something like that. Not that kind. You should be firm and you should be confident, very polite and well spoken. So the next point is reliability. You should respond to people very promptly and follow up on promises in timely manner. Okay. If you say that you're going to do an OPD checkup on next Friday, it means you are going to do it on next Friday. You cannot postpone it. And you should clarify everything, especially when there is something to be changed, to make sure that you are on the same page with your patient and to eliminate any kind of surprises to them. See, in our profession, if you give surprises every now and then, suppose you want to operate a patient on appendectomy, you want to take out the appendix, but on opening, you find another thing. For example, the gallbladder is full of stone and about to burst. Emergency situation it is, but it should not arise. You should do your work thoroughly, give a thorough checkup first, thorough investigation so that there is no nasty surprises for the patient as well as for you. These surprises will always lead to chances of medical litigations, cases in the court for medical negligence, for all those things, violation of medical ethics and all. So you should do your work very thoroughly and you should be always reliable. And the next one is competence. So when we say competence, you should become an expert in the field. You should have enough knowledge and skills. This can be achieved by continually your education, by taking courses, attending seminars, attending any other professional works like conferences, continuing medical education seminars and everything, and always reading off your books. But these are required in order for you to stay in top of your field and be confident. Then ethics, very important. You should always display ethical behavior at all times. In our profession, if you don't follow the ethics properly, your medical registration can be struck out from the registry. We have a council, National Medical Council, We have, before that, there was the Medical Council of India, MCI, now it is the NMC, but we maintain a medical register for all the registered medical practitioners. Those whoever practice in India has to be registered in that registry. If you are not practicing ethical behavior and a case is arise against you, your name can be taken out from that register. Once it is taken out, you can do an appeal, but if your appeal is not heard, then you permanently lost your degrees. Right. So that is very important. The next one is maintaining your poise. A professional must maintain his poise even when facing a very difficult situation. When you are challenged or questioned, you need to be able to state your case in a calm and structured manner and keep it very factual, clean, and to the point. Most of the time, when we face cases in the court, like us forensic experts, we always have to go to the court to deliver evidence. Most of the time, the lawyers, they used to try to undermine our authority, try to make us look as if we are wrong. Okay, all the time they like pulling our legs. So suppose if you are in that kind of a situation, you have to be very calm. You cannot lose your composure at any time. If you start getting angry, then you have given them a weapon. They will make you get angry more and more, and then they will find faults. So you should never lose your composure. You just state the fact. That's all. Nobody can deny a fact. Then phone ethic. Now, when you are in consultation over a call, over a phone call, okay, that time you should always state your full name and title. And do not try to dominate any conversation and try to be a good listener. Then comes return correspondence. During any return or email correspondence, keep your letter very brief and to the point. Then accountability. Our professionals are always accountable for their action at all the time. Remember that it's all the time, okay? You are accountable at all the time. Whatever you do, it's all accountable. You cannot say, I was lazy that day, I was sleepy that day, and I didn't do it nicely. No excuses. And do not try to blame your colleague. Do not say that I was doing it right, but my friend, say suppose Sila, she told me that it should be done this way, so I did it that way. No, you cannot say that. You should not never blame your colleagues. You have to take accountability of your own action. Why did you listen to her in the first place, right? So you should try to take accountability of your action. Okay. Then that is how a professional should act in brief. It's not just medical. Even if you go to other profession also, that's how you have to act. Then comes attitude. Attitude, I'm going to talk mostly about being a medical professional. Okay, so being a medical professional, your attitude should be to render service to the humanity. You should have empathy, sympathy for the suffering people. Okay, then you should be an upright person. You should be respectable, you should act respectably, and you should be instructed in the art of healing. You should be very modest and sober at all times and be very patient. If somebody is complaining about something, about a pain, for example, in the chest, even though you think it may be because of gastritis, Because of heartburn, you cannot just go on, bang on and say, no, 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 this must be this. So stop complaining. You cannot say, you have to be very patient and listen to all their complaints and then try to calmly counsel them and give them good advice. You should also be very hardworking. Hardworking is the key to success in this profession. Nothing comes easy. It's going to be very hard for you from the first year itself. Sincerity and hard work, it's all that matters. If you are consistently hardworking and being sincere to your studies, it will be reflected. Every day counts. We are not in a general line course, not a BSc, not a BA pass, where you just have to mug up everything in the last moment and you can give the exam and come with your flying colors. For us, it's everyday work. You have to start studying from day one, and then you'll go on studying till the end of your life. In medical profession, the studying never ends. Okay. You have to be very dedicated to your course and passionate about it. And one more thing is that you cannot let your emotion affect your judgment. Suppose you find someone who is in very much pain at the terminal end of a cancer, and you are so sympathetic, you feel their pain, you don't want to treat them anymore, you feel that making them die is better, but this should not happen. You should go on, you should get hold of your emotion and do the best thing for the patient. Okay. And you should be confident in your knowledge. If you're not confident, you will not be able to apply that knowledge that you already have. And you should separate your professional and personal life. Suppose you are very angry, you have been provoked into a fight at home, you're angry, you came to the college, you meet the patient. If you take out your anger on the patient, that is not being a professional. You should never do that. You leave your personal life at home. Once you're in the hospital, you're a doctor. Your emotional, your personal life should not get into it. If you're going through a breakup, you're very much depressed, you don't feel like doing your 24-hour night duty, you don't feel like treating the patients, you're very bored, that doesn't make you a professional man. You should learn to keep aside everything personal and then be the doctor that serves humanity. All right. You should be able to conduct yourself with propriety in your profession and in all of your action in life. You should be able to discharge your duty without anxiety. If some emergency case comes, a severe RTA, road traffic accident comes, and you started panicking, who's going to help the patient? You should not panic. You should not get anxious. All right. And a doctor should consider it a pleasure and a privilege to render gratuitous service to all the physicians and their dependents. All right. You should treat your colleague, the doctors, any doctors, with pleasure. You should always extend a service of gratitude. Okay. Now we are coming to medical ethics, right? Now medical profession as such is governed by legislatures and a code of medical ethics. These principles and ethics are formulated by the national and the state medical councils and the World Medical Associations. So previously we used to have the Hippocratic Oath and Declaration of Geneva as a code of conduct which will govern how a doctor should behave. But recently, Charak Samhita, Sage Charakas Sampat was introduced as a code of in place of Hippocratic Oath, but it's okay. But still, we are following the Declaration of Geneva, which broadly give you the code of ethics. So, what is a medical ethics? Medical ethics is nothing but a set of rules which deals with the moral principle which will guide the members of the medical profession in their dealing with each other, their patient, and the state. So this will help you in how to deal with what kind of a situation that arises. All right. Now, according to the Declaration of Geneva, it broadly says that you are going to pledge your life to serve humanity. Then you're going to give your teachers the respect and the gratitude which is their due. Practice medical profession with conscience and dignity. The health and the well-being of the patient will be the first consideration. And to respect the secrets which are confided in me even after the patient has died. Whatever things that patient disclose on you, you have no right to gossip about it. Okay. If a patient has said some very discriminatory private word to you about their relatives, their husbands, the wives, the children's, if the patient does not give you the right to disclose it, you cannot disclose it. This is called professional secrecy. If even in a court of law, if the court asks you to disclose your professional secrecy, you can say that I will keep it because it was disclosed to me by my patient. But if the court still insists on disclosing that secret, then you have to give it in writing to the judge only and none others. That is how secret you have to keep it. Okay. Then you have to maintain in your power whatever honors and novel tradition of the medical profession. Your colleagues will be regarded as your brothers and sisters, and you would not permit any religion, nationality, race, or political parties or social standing to intervene between your duty and your patient. Suppose not in the northeastern state, we don't have that much caste system, but outside the northeastern states, in the mainland India, there is lots of castes. There's low caste, upper caste, the middle class, and everything. So, like, you cannot choose that you're going to treat your upper caste people much more nicer than the lower caste, or you cannot say that I'm going to examine the upper caste people much more faster or before the lower class. You have to prioritize your patients according to who need your attention urgently or not. Similarly, like you are a Muslim and then you said, I will only treat Muslim, or you are a Christian and you say, I will only treat a Christian and none other, that cannot be done. And then You have to maintain utmost respect for human life from the time of conception. You cannot just take it very lightly, like suppose accidentally I kill a person today. No, 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 you cannot do that. You have to give respect for the life, even from the time of conception. You cannot just go on doing medical termination of pregnancy just like that. You have to be abide by certain laws and regulations which is given by the government and by the lawmakers, like the Medical Termination Act and all those things. And then even under threat, you cannot use your medical knowledge to contrary to the law of humanity. A good example is you cannot help in tortures, even at the threat of your life. Okay, and then you will abide by this code of medical ethics. You have to abide by the code of medical ethics. And all this thing you're gonna do it freely and upon your honor. Since we have already discussed some points of the ethics, now let me tell you what are some unethical acts that is regarded very unethical and which can lead to removal of the name from the medical council and which will enable you to practice medicine anymore. Number one is advertising. You cannot advertise your skills. You cannot call patients, or you cannot broadcast in the medias or in the newspaper saying that I can do these things and this patient can come to my clinic. This is a strict no. Okay, then but you can make a press release saying that I'm changing my OPD timing from this to this, or I'm changing my location from being in Falcon to Aizawl, like that. You can do like that, but you cannot advertise your skills. A doctor, if he discover a new procedures, or if he has found out a new instrument or a new device which will be beneficial to the humanity, he can, of course, make a patent of it. He can make it in his name. He can have a copyright, but he cannot refuse its uses to the whole population. He cannot say this procedure was discovered by me, this procedures was invented by me. I would not share this, how to do the know-how of this procedure. I alone will benefit with it and I alone will practice it. No, you cannot do that. You have to share it to the whole population. Those who want to learn from you has to come and learn from you, and then you have to share it with everyone. But you can put it under your name. You cannot run an open drug store and start giving out prescriptions prescribed by other drugs. And then you cannot split fees. Like, for example, you send out lots of people, those are called PIMS. Though these people will catch patients from here and there, and they will come, and the patients, the fees that you get from the patient, if you're splitting with them, it is not ethical. You cannot split fees with the pharmaceutical companies for prescribing their drugs. You cannot split fees for referring your patient to other hospitals or any other diagnostic centers. Okay. There is no such thing as secret remedies. If a doctor is giving secret remedies, then without any level, without any composition mark, then it is unethical. Human rights. If you are aiding and abetting in torture, that is unethical. If you are a party to either infliction of psychological or physical trauma, that is also not ethical. Euthanasia, a burning topic nowadays in the world's platform, is euthanasia. Euthanasia is ending a person's life. It can be active, it can be passive. Active is when you are doing something like, for example, taking out the life support and making the person die. Passive is when you are not doing anything and making the person die. This type of euthanasia is still strictly prohibited. It is unethical still now. If you are receiving gifts, monetary money, gifts, or any travel expenses, big appliances, TVs, anything as a gift from any of the drug companies, the pharmaceutical companies, the medical representatives, so that you prescribe their drugs and enhance the sale of those drugs, then that is also unethical. So there is a word which we use when a person is not being ethical. It is also known as infamous conduct. Okay, infamous conduct or professional misconduct. So any conduct of the doctor which might reasonably be regarded as disgraceful or dishonorable as judged by professional men of good repute and competent from the same profession, that is regarded as infamous conduct. So what constitutes an infamous conduct? Infamous conducts are any unethical practice. Like I have mentioned before, those unethical practices that the doctor may be having. And now another one is not maintaining records. Actually, record has to be maintained. For OPD patient, the record has to be maintained for at least 3 years. For an inpatient, the record has to be maintained for a minimum of 10 years. If you are not maintaining this record, and if anything came up, if any public litigation come up and you are unable to provide the records, then it is also regarded as an infamous conduct. If you are found absent in more than 2 occasions during any inspection on your clinic, on your health facilities, it is also regarded as unethical or infamous. If you are engaging in adultery, you know what is adultery? Adultery is if you are having a relationship with another person, whether it is male or female. If you are male, then if you are having any other relation with a female while you are still married. Okay, if you are female, if you are having a relationship with another man when you are still married to your husband, these are called adultery. If you are engaging in adultery, this is also regarded as infamous conducts. If you are drunk or disorderly during your duty time, if you have taken drugs during your duty time, these are also not regarded as infamous conduct. If you are convicted by a court of law, if you are conducting sex determination tests, whether it's a female or male fetus, if you are determining the sex of the fetus before the birth, then it is also regarded as infamous conduct. If you are giving false certificate, that is also regarded as infamous conduct. And if you are violating the provisions of Drug and Cosmetic Act. And another point is that if you, since you are a doctor, you can prescribe many drugs. And if your prescription is there, then the pharmacy will provide the drugs to the person, right? So if you are providing habit-forming drugs and drugs of addiction to your patient, that is also unethical and is regarded as infamous conduct. If you are giving cover to unqualified people to help in your clinic, to help in performing operations, then this is also known as infamous conduct. If you are conducting illegal operations and illegal abortion, that are also infamous conduct. If you are disclosing professional secrecies, infamous conduct. If you refuse to treat a patient on religious ground, that is also an infamous conduct. If you are publishing photographs or case report without consent of the patient, if you are using touts or agents to entice the patient to come to your clinic, and if you are involved in drug trials, research involving patients, and not abiding by the ICMR guidelines. ICMR is Indian Council of Medical Research. If you are not abiding by their guidelines, then you are regarded as having infamous conduct. And then again, if you are advertising your skills, then it is again infamous conduct. So briefly, the infamous conducts are the 6 A's: association with unqualified people, advertising, abortion, adultery, addiction, and alcohol. If you are having these 6 A's, then it is regarded as infamous conduct and your name will be erased from the medical registry. So that's the brief about ethics and how you should conduct yourself and how you should protect yourself from any possible litigations. All right. So anything that you want to ask, you want to interact?
Ma'am, one question.
Yes.
Doctors are not allowed to have a pharmacy store.
Yes, I could not get your question. Please, can you please repeat it?
Doctors are not allowed to have pharmacy store.
Doctors are allowed to have pharmacy stores in their practice, but it should disperse only his drugs, the one that he prescribed, not the one that has been prescribed by other physicians. That is like running an open shop. Do you understand?
Yes, ma'am. And ma'am, one question.
Yes.
It's not that I'm gonna be drunk or like that. Ma'am, if we are caught drunk after our duty or after our work.
It's okay, it's your personal life then. It's not like you cannot get it's not like you cannot drink alcohol at all time. It's just that during your duty hours, when you are attending to your patient, when you are in the hospital, you should not be drunk. You should not be under the influence of any drugs. Okay, sometimes it so happened that doctors are partying and suddenly he has an emergency call and he comes to the hospital, right? If he is found drunk during that time, then he is liable for prosecution. But rest of the time, when you are at home, you can enjoy yourself. When you are free from your duty hours. Yes, anything else?
Ma'am, one question.
Yes.
Suppose that there was a mistake during an operation or treatment.
Yes.
Caused the death or maybe some difficulties with the patient. How will we deal in that situation?
Okay, you are saying that suppose there is some mistake in giving the medicine, right? And some treatment which mistreatment, should we say. Okay, in those situations, what happened is that it will be a case of medical negligence, right? If you think that the drug is correct, then you have to defend yourself. And then it will be trial in the court where other doctors will give their evidence saying that these drugs were okay to give or not okay to give. All right. But if you If you know it from before that this drug should not be given, okay, and still you are giving it, then it is a pure case of gross medical negligence. It's because of your lack of knowledge that the person has died. That's why we always say we have to research everything, we have to know every details, and we have to know the latest treatment methodology and become a very competent and skilled person. All right. Otherwise, it will be known as medical negligence.
Ma'am, what are the consequences for medical negligence?
Consequences, it depends. It can be civil negligence or a criminal negligence. In a civil negligence, what happened is that the person has suffered some damage. The person has not died yet. The person has suffered some damage. In this case, you will be tried in the consumer court, and then you maybe are asked to pay monetary fine. Right. But in a criminal negligence where it resulted because of gross, I'm stretching on the word gross, okay, very huge mistake from the medical practitioner side, a very huge mistake, a very gross mistake, which lead to the death of that individual, of the patient. In this case, it will be tried by the criminal court, and the person may be sentenced to imprisonment along with monetary fine. And as well as the person's name may be taken out from the medical registry. So these are the punishments.
Okay, ma'am.
Yes, anything else?
Miss,
Yes.
according to you, can there be a VIP patient or just a patient?
There can be only a patient, no VIP, no no lower caste, no upper caste. It can be only be a patient. Every patient should be equal in your eyes. Okay, the way you treat them, it should be equal. Like for example, suppose, let me say, the chief minister of the state came to your clinic. You are like ordering tea, coffee, everything for him, and then you are like fawning over him. It's not supposed to be done. You are supposed to listen to everyone, each and every one of your patient, with equal understanding, equal empathy, equal sympathy, and equal, you should try to do your level best to treat them equally. Okay, it's not like very high profile people came, then you become extra special in your treatment, you become so good, you do every test, you do every diagnosis, you try to do as much as you can, and when a very poor people come, you think, go away, it's you're wasting my time. It's not like that. You have to treat them, everyone, equally. Every patient is equal in the eye of the professional doctor. All right.
Yes, miss.
So anything else?
Ma'am, again regarding the pharmacy store,
Yes, yes.
I still did not understand what you said. Like you cannot, how will I say, you cannot sell others, doc, others doctors medicine or like that. I did not still understand that.
Yes, that's what. No, if you are selling other people's pharmacy and if you are opening the pharmacy and sitting there yourself and selling every other medicine, then it means as if you are owning that pharmacy, right? That is against the ethics. That is called running an open shop. Okay, that is against ethic. But if you are prescribing, you are selling whatever you prescribe on that shop, then it become okay. So this is a very fine line actually, because you are prescribing what every other doctors are prescribing, right? Now, it's not like you are prescribing a very special kind of medicine which is only manufactured by yourself. So basically what it is a very fine line between what is ethical and what is unethical. So actually some doctors are running pharmacies. We know that. So the thing is, suppose you are prescribing paracetamol. Paracetamol comes in different brands, different varieties. But other pharmacies are also having paracetamols, right? Other doctors are prescribing paracetamol. That doesn't mean that you cannot sell paracetamol. You are also prescribing them. So the drugs, what your pharmacy has got, may be similar to what other pharmacies are also having. Okay, now you get my point. In terms of ethics, you are not supposed to sell drugs which other physicians are prescribing, but you are also prescribing the same kind of medicine that other doctors are also prescribing. So basically you are selling everything. You are still confused.
Yes, ma'am, still confused in the topic.
Ma'am, does
Yes.
that mean that suppose that we are a gynecologist, okay? That means we also run a pharmacy shop, and if we are a gynecologist, that means we cannot sell other medicines like which are related to other doctors, like which are related to the lungs, maybe something like this, which is not related to our prescription. Is that what you are trying to say?
Yes, it's supposed to be like that, but suppose your patient came, okay, for suppose minor, you are gynecologist, obs and gynae, right? You are concentrating with treating the patients from the obstetric point of view. You are treating like from the baby conception to the birth, right? But if that mother, the expected mother, is having some kind of a throat infection or a lungs infection, you're saying lungs medicine, then it's okay to prescribe a antibiotic which is safe both for the baby and for the mother. And if you are keeping that medicine in your pharmacy, it is okay. All right. Everything is related actually. So it is okay in that time. Suppose a expectant mother is asthmatic. All right. And you ask her like what is her asthma history. She gave the history. She's taking this kind of medicine. And you said continue this asthma medicine. And if she's buying from your pharmacy, it is okay, because you are advising her to continue to take the asthma treatment. Now you get it. So that's what I'm saying. It's a very fine line between what is to be given in your pharmacy and what is not. So I think our time is already up. If you have anything more to ask. Okay, then we'll finish our session here. Thank you so much for listening today.
Thank you, ma'am.
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 You also said.
Thank you, ma'am. Kalong mein, ma'am.
Thank you, ma'am.
Hello. Good afternoon, everyone. Can any one of you tell me whether I am audible or not?
Yes, ma'am.
Yes, ma'am.
Okay, so, okay. We will be starting our session. But before that, I would like to see all of your faces. So turn on your video once. Let's all turn on our video. Okay, good. So just want to see who all are here, because since we cannot have physical classes, we are conducting this foundation course online, so we cannot see each other face to face. So since this is the first time we are meeting, just want to see all of your faces, whoever is there, just for some 5 minutes. Okay, so is there anyone from outside the Mizoram?
Yes, ma'am.
Okay, so how many of you have been admitted so far?
There are 3 of us.
Okay, 3 of you, good. And the rest are so far Mizos, right? Then can I see how many of you have been admitted till now? Any one of you can tell me?
There are total 79, I guess.
79 students so far. Okay, good. So we will be starting our session for today for the foundation course. Actually, my class was supposed to be on 23rd, but due to some upcoming events, I have exchanged this class with the sir who was supposed to take today. So, okay, I will share my screen. We will be talking about handling of biomedical waste. Okay, so we will just have, can you see my screen now? Is my screen visible for all of you?
Yes, ma'am.
Okay, good. So I'll just make it into slideshow. So we will just briefly talk about what we will be encountering in our hospital setup, okay, regarding the waste. So this is just for an introduction. Am I audible?
Yes, ma'am.
Okay, good.
But your connection was disrupted a few seconds back, I guess.
Can you hear? Oh my God. Hello. Okay. Any one of you, if you can hear me, can you just tell me?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay, so there was some technical glitch here, so I'm just trying to reconnect and I'm just trying to share my slides again. So just hold on for some maybe 2 minutes. Okay, so in the meantime, can any one of you tell me what do you understand by this biomedical waste? Any one of you?
Ma'am, like needles and syringes, we can't use them again. And hospital waste, used bandages and all that.
Okay, very good. So
Urine samples and everything, blood samples.
okay, good. So anyone else? Do you
Any
want to
kind
add?
of waste containing infectious materials.
Okay, very good. So now I think most of you know the literal meaning of the biomedical waste, right? So yes, today we will be talking about how to handle this biomedical waste. So I cannot share my slide yet. My slides are still unable to share. So I'm taking this class from my phone. Just having some problem with my laptop. So just hold on. Even though if we cannot share anyhow, we will just talk about the waste. Okay, so yeah, like your friend said, any waste that has been generated from any healthcare institute, it may be a hospital, it may be a nursing home, it may be a lab, it may be any kind of hospital, army hospital, or any dispensaries, right? So anything that has to do with healthcare, the waste that are generated from those facilities, they are known as biomedical waste. Okay, so what we have to know here is all these waste generally only around 70 to 90% are, I mean, the 70 to 90% will be non-infectious, and only a small proportion of the waste will be infectious. Okay, so around 15 to 20% will be infectious, right? So we have different types of waste. So can you tell me, any one of you, do you know what are the different categories of waste in a healthcare setting? Can anyone tell me? Yeah, one is sharps, needles and all. You said,
Biodegradable and non-biodegradable.
okay, biodegradable and non-biodegradable. Those are concerned with a bit of the general waste. Okay, not the healthcare waste. Here we are specifically talking about the healthcare waste. So can you tell me some of the categories of healthcare waste that you might have heard of? Anyone?
Human
Yeah, it might
potential
be a
and
little bit new for you all. So we will be having different types of waste. Okay, so it could be sharp waste, then it could be a pathological waste that you will be knowing later on. What are the pharmaceutical waste? Then what are the chemical waste? What are radioactive waste? So these are some of the waste that we will be seeing in a hospital setting. Okay, so what we have to know about this waste is that these waste which are generated from the hospitals, they have a potential to cause infection if they are not handled properly. Okay, so it could be very infectious. So we have to take good care when we are handling the waste. And what you have to know is, have you heard of PPE? I think we have all been very familiar with the word PPE. Anyone?
Yes, ma'am.
Yes, what is the full form of PPE?
Personal protective equipment, I think.
Very good. Okay, so personal protective equipment. So what do they do? What are their functions? Anyone? Do you know the function of a PPE? Just hold on a second. Okay, I'll just turn off my video, but in the meantime, answer the question. So what do you understand by the PPE? What are the roles of PPE? What do they do? What roles do they perform?
Protection.
Protection from what?
Infectious
Spreading
agents.
of disease.
From the virus.
Okay, if you talk about COVID, then it is protection from the virus, right? But personal protective equipment in general, they are the protective gear which it will protect the healthcare staffs, the healthcare workers, or any of the staffs from any infection, any potential infection. Okay, so we have different types of personal protective equipments which have to be used depending on the risks risks that we are exposed to. So can you give an example of some of the protective equipments? Anyone? Yes, very good. Goggles. Then
Marks.
mask. Okay, very good.
Gloves.
Anything else? Gloves.
Gloves.
Very
Surgical
good.
gloves.
Yes, very good. Surgical gloves. Then
Earplugs.
earplugs, very good. Earplugs, usually it will be it's a protective equipment, especially where there are heavy machineries. Okay, and anything else? What about for the feet?
Gumboots.
Yes, very good. Boots and all are also there. Okay, so all these protective equipments we are using for handling, not only for handling waste, but to protect ourselves when we are caring for the patients or when we are giving care in the hospital, right? Okay, so just 1 second again. Let me try to share my screen. Okay. We will look at my slide. So can you see my screen now?
Yes, ma'am.
Yes, ma'am.
Okay, so very good. So I want one of you to read the definition of this biomedical waste. Can any one of you read the this biomedical waste definition? Anyone would like to volunteer? I cannot see your names anymore. So
Any waste
okay, very
generated
good.
during diagnosis, treatment, or immunization of human beings or animals, research activities pertaining thereto, or in production or testing of biological or in health camps,
Yes.
including the categories mentioned in Schedule 1, appended to BMW Rules 2016 and its subsequent amendments.
Very good. So for now, for the time being, what you have to know is for the first and 2 bullet points. Okay. So these are the ways that when we say biomedical waste, the definition is given here according to the, when we say BMW, it means biomedical waste. Okay. So according to the biomedical waste management rules, the biomedical wastes are being defined in the rules, and you will be hearing all these BMW every now and then. Once you come start your classes, you will be exposed to all these biomedical waste, and you will be hearing this term a lot of times. So when we say BMW, you have to remember that it is not the car that we are mentioning. Okay, we are not referring to the car. I think every one of you know the car BMW, right? So we are not talking about that car. We are talking about the waste when you are in the hospital setting. Okay, so if you see the next slide, this healthcare waste, as I told you, around majority, the maximum of the waste that are generated from hospitals are also general waste which are not infectious, and around only 10 to 25% are hazardous or infectious waste. Okay, so remember this point. You will be all waste will be generated from every corner of the hospital setting, not only in the hospital, from the office side also, but most of the waste that are generated will be non-hazardous or considered as a general waste, and only 10 to 25% will be hazardous. And if you see this biomedical waste, The non-hazardous, as we have already said, it will be a general waste, and the hazardous, which constitute 10 to 25%, will be infectious and the other hazardous waste. So when we say infectious, if you see the column, then you will see it will be comprised of non-sharps, sharps, and plastics, then liquid waste, and the other hazardous waste, which includes radioactive waste, discarded glasses, pressurized containers, chemical waste, and incinerated ash. So these are some of the examples of healthcare waste or biomedical waste or BMW. Okay. Then what are the sources of healthcare waste? So as I have already said, it could be some from the hospitals. Hospital is the main source of all these biomedical waste. Could be other healthcare facilities, maybe in the OPD clinics, maybe in the dialysis center. Okay, so it can be from anywhere where healthcare has been rendered. And some other sources can be also from these transfusion centers, then nursing homes, polyclinics, prison hospitals. Then others would be of these laboratories, related to laboratories and research centers, then mortuary and autopsy centers. And do you know what is mortuary and autopsy? Have you heard of these terms?
Yes, ma'am.
Okay, so I assume that you will know. Okay, so mortuary is a place where we keep dead bodies, right? Then it could be all waste can be generated from the mortuary, from the animal research and testing centers, or the animal labs, then blood banks, nursing homes, from the elderly. So we have talked about the category of healthcare waste. Then according to the WHO, do you know what is the full form of WHO? This should
World
this
Health
should have been
World
Organization.
Health
capital letters.
World Health
Sorry, it's a
Organization.
printing mistake, typing mistake there. So you have heard of WHO, right? So if you are a medical student or if you are in the medical field, you have to know WHO. What is the full form of WHO?
World Health
World
Organization.
Health Organization.
Very good. So once you come to the medical field, this is the biggest body or in the health department. Okay, so we have to know what is WHO, the full form, and we have to know where the headquarters are. Okay, we have to be very familiar with the WHO. So according to the WHO, waste, these hospital waste or healthcare waste are divided into 6 categories. So can you tell me, so can one of you read the 6 categories? Any
Sharp
volunteer?
waste,
Very good.
infectious waste, pathological waste, pharmaceutical waste, cytotoxic waste, chemical waste, and radioactive waste.
Okay, very good. So these are some of the ways that are being categorized by the WHO, and it has in the next column, if you see the corresponding column there, examples are given for each category of waste, right? So these are some of the examples of the ways that we will be seeing every now and then in the hospital or the healthcare settings. Then this is a pictorial illustration of the different types of waste in the next slides. Okay, so the most important part is here, the waste segregation. So we have already known that there are different types of waste, 6 categories of waste according to the WHO, and according to these categories, the place where we will be disposing them and storing them or discarding them will be different, and we have a system known as a color coded system. Okay, so we have different color coded bins where different categories of waste will be disposed of in those corresponding bins. So we here, if you see, we have different colors. What are the colors that we are seeing right now? The different colors, colored bins. We see black, we see red, we see yellow, we see blue, and we see white, right? So according to the BMW rules that we have just talked about, all these waste, different categories of waste will be discarded into different colored coded bins, okay? So the general waste will be, or the non-infected waste that we have talked about, they will be disposed or they will be segregated in the black bin, and in the red bin, we will be disposing some solid waste, all those solid waste which have been soiled or which have been infected by maybe blood, maybe a different type of body fluids. And in the yellow bin, we will be disposing all those anatomical waste. So I think by now you must have heard of you must be familiar with the term anatomy, right? So all these anatomical, that means the human body parts, any human body parts which have been generated as a waste will go into the yellow bin, right? And in the blue bin, what do we have? We have all these infected plastics, syringes, gloves, and plastic waste. All the plastics waste which are infected will go to the blue bin. Remind you here, plastic waste which are not infected will go to another bin. Like for example, the wrappings of food, maybe the wrappings of some eatables will go to another type of bin, maybe the green bin or the black bin. Okay, for you, what you have to remember is the red, the yellow, the blue, and the white. And in white or translucent, we are disposing sharps and needles. Okay, so this picture is very important. Just remember, I want all of you guys to remember that we are having 4 color-coded bins. Forget about the black. We will be having 4 color-coded bins according to the BMW rules for infectious waste. That is the red, the yellow, and the blue, and the white. Okay, so depending on the types of waste and the type of their treatment, different waste will be disposed in these different color-coded bins. Okay. So now, can anyone read these health hazards of healthcare waste?
Hazards from infectious waste insert HIV, hepatitis B, hazards from chemical and pharmaceutical waste.
Yes.
From genotoxic waste.
Yes.
From radioactive waste.
Yes.
Activity.
Okay, good. So this slide is telling us that from all these different categories of waste, there can be some hazards for the human, and that we can get some infection from all these waste, okay, if they are not handled properly. So for example, infectious waste and sharps, like for example, we are saying that used needles and syringes, blades, if we touch them, or if we got pricked or cut by all those used needles, then we have a chance of getting HIV infection or hepatitis B infection. Then the second thing is the chemical and pharmaceutical waste. If we are exposed to chemicals, we might get burns in our skin, right? And we might due to those burns, the burns can get infected. So we can get infections from all these different types of waste. Okay, so this is telling us that we are, as a healthcare worker or as a healthcare provider, we are at risk of getting infections from the biomedical waste that are being generated from the hospitals. So see from this next slide, if you see the categories of persons exposed to risk of infection. So who all are exposed to the risk of infection from this waste? As you know, sanitation workers are also those who are handling the waste, have a high chance of getting infection from the waste. And the medical staffs or any healthcare providers and healthcare workers are also exposed to waste, so they have a chance of getting infection from this waste. And even the patients themselves have the chance of getting infection from different types of waste. Not only these people, but also the visitors who come to visit patients in the hospitals, and those who come for outpatient checkup, they are also exposed to all these hazards from these waste. Okay, so everyone who comes to the healthcare facility is exposed to the hazards of this waste. So we have talked about the personal protective equipment. So you have already given me the example, the different components of personal protective equipment. Like you said, we have this face shield and goggles, mask, gloves, gowns, shoe cover, head cover, right? So these are the getting exposed from any infectious or hazardous materials. So if you see this diagram or this picture, you see the different types of PPE. Okay, so not only PPE has to be worn by the treating physicians or the doctors or the laboratory technicians, it has to be worn by the people who are handling the waste also, so that they are not getting any infection from handling the waste. Okay, so even the waste handlers should also wear the proper PPE. So if you see here, when handling hazardous or infectious waste, we should always wear personal protective equipment. And it should include what? Face mask. Then it should also include gloves, some aprons, then some trousers and boots. Okay, so that she or he is protected from the likelihood of getting infection. So the points to remember from this about handling the biomedical waste is that the waste, when generated, it will be generated from different hospitals, different sites, different wards, different departments. It should be properly segregated, and it should be we should remember that they have a potential to cause infection. So we have to be very careful while we are discarding them, not to injure ourselves or not to get ourselves infected from the waste. Then we have to remember that segregation at the source reduces risk, meaning if we are generating waste in the ward, then it has to be properly segregated. Like for example, a nurse is giving injection to the patient, that time she will be generating sharp waste, right? So she has to discard or segregate the sharp waste into the correct bin. Okay, so the correct bin was white, right? So she will be discarding the sharp waste into a white bin or a translucent bin at the point of generating the waste. Then we have to remember that for the infectious waste, according to the biomedical waste management rules, we have 4 color-coded categories of waste, which are the red, the yellow, blue, and the blue and white. Yes. Then we should remember that we should not keep the waste collected to just be stored like that for a long period of time. Usually we have to dispose to the final disposal site at within 48 hours. Okay, so waste should not be stored for more than 48 hours because they have a tendency of decaying, and they have a tendency of attracting flies and maybe animals which can transmit diseases. Then we have to remember that we have to use personal protective equipment while handling the waste, not only waste, even for the sharps and anything to do with healthcare. Providing healthcare, we have to protect ourselves from potential risk of infection. Okay, so and this PPE, later on we will be learning them again. The different types of PPE which has to be worn will differ from the different categories of risk. So that you will learn more in detail as you come along, as you progress along. So for today, those are the things that you have to keep in mind. It's just a short introduction of what are the types of waste we will be seeing in our healthcare institution or the hospital side. Okay, so these are the things that you have to keep in your mind when you are handling with any healthcare services. Okay, so that will be all for today. It's just a short introduction or overview of this waste from the hospital. Okay, so I think after this, you don't have any more classes, right? Any more foundation course? This is your last session for today. Am I right?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay, good. So now I think we will stop here. Okay, never mind. Okay, I think I will stop here. Are you clear? So remember only some important points. Okay, 4 color-coded bins, which is important for infectious waste. Then you have the PPEs. When you handle waste, you have to wear proper PPEs. Okay.
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, then that is for
Thank you,
today.
ma'am.
Okay.
Thank you, ma'am.
Thank you, ma'am.
You, ma'am.
Thank you,
Thank you,
ma'am.
ma'am.
Thank you, ma'am.